Welcome to the Etiology Professional Acne Presentation. This is one of my favorite PowerPoint presentations because so many of my clients suffer from acne, and there really is a lot that can be done to ensure that you can treat and help prevent acne from reoccurring. I am Catherine Pacelli, and I'm a Master Clinical Esthetician, and I'm also Director of Medical Aesthetic Training and Services for Etiology, which was Intaglio. My phone number is 360-460-9111, and my email address is catherine.etiologyskincare@gmail.com. And please contact me. I would love to speak with you and help you out with any of your acne problems and any other type of problem, hyperpigmentation, aging skin. We do it all. I own a day spa. I'm in the state of Washington. And so I take all of our products and put them to practical use. So I know that they work, and I know that the treatment protocols also work very well. So I'm very excited to spread the news. Etiology, we have products for the face. We have products for the body, hands, and feet. And we are really a versatile range which enables you to offer treatment solutions for your client. We are very well versed in the spa professional, as I am a spa professional myself, and we also work with medi-spas and plastic surgeons and dermatologists. I worked for plastic surgeons for 14 years, so I'm very familiar with the medical aesthetic field. Today we're going to talk about acne, its causes, its contributing factors, its prevention treatments, and protocols. We're also going to do a little bit of etiology product knowledge with some of the key ingredients that we believe can really make a visible difference in your client who has acne skin. We're going to start first with a little basics. Most of you know this, but it's always good to go ahead and review. What is acne? Well, it's an inflammatory skin condition. It has superficial skin eruptions. This occurs when the sebaceous glands within the hair follicles or the pores of the skin become plugged. You can't have a pimple without a hair follicle. Also hormones, hereditary, stress, humid weather conditions, bacteria, and increased sebum production can also produce acne. These are the types of lesions that we have. We have your normal follicle with your hair shaft going up, and then we have an open comedone, commonly known as a blackhead. We have a closed comedone. Those are more difficult to treat because the skin grows over it, and that is commonly called a whitehead or milia. Then we have a papule. A papule is inflamed, and it's usually red, and it may or may not contain pus. And then we have your pustule, which has the white pus sac, and we have a nodule, which is your cyst. And your cyst can take over several hair follicles and is always inflamed and rarely comes to a head, and they are very difficult to treat. There's four grades of acne. I know in California that they've taken away the esthetician's ability to treat grades 3 and 4. In the state of Washington, where I am, we still are allowed to treat all grades of acne. But you have grade 1, which is your inflammatory acne. It consists mainly of blackheads and whiteheads with an occasional inflammatory lesion like a papule or a pustule. Grade 2 is a mild non-inflammatory. It consists mainly of whiteheads or milia that are not inflamed or infected, and they are the most difficult form of acne to treat. Your grade 3 is an inflammatory consisting of papules and pustules mixed with milder non-inflamed lesions, and they respond well to topical treatments. Then you have your grade 4, severe inflammation, and usually these are referred to a doctor. They consist primarily of cysts and all inflammatory and non-inflammatory lesions. Typically, it's characterized by severe inflammation and purplish discoloration. You've seen the really bad acne with the cystic acne, and it really does require medication because it usually is systemic and it is caused from the inside out. Types of acne lesions: non-inflammatory, open comedones, blackheads, closed comedones, milia. And we have, you can see those great blackheads. Don't you just want to get in there and extract all those? And here are the closed comedones, the whiteheads or the milia, and they're very difficult. In the state of Washington, we are allowed to use a lancet, which really helps in the extraction of whiteheads and milia. The types of acne lesions are inflammatory are your pustules, your papules, and your cysts. Of course, your pustules are a pimple and it has that little pus sac, which is really easy to see, and it's made up of the debris of dead white blood cells actually, and the pus may spread the infection. So be very careful when you're doing extractions on your pustules. Your papules are the same thing. They are more red in color, and these take a long time to heal. They may or may not have pus in them. The cysts are extremely painful, inflamed infection of the hair follicle and sebaceous gland. It destroys both of these appendages and spills into the surrounding dermis and hypodermis. Cysts are most likely to leave a scar, but I have found a really great cure for cysts. And I'll talk a little bit more about how I use my salicylic acid peel and work on those cysts. These are the papules I talked about. They're the redness. As you can see, there's some pustules mixed in there. And this is a hard thing to treat, but there are some wonderful topical treatments that will really make a visible difference. And these are the pustules. Wouldn't you just love to get in there and extract all those pustules? I tell you, it's just an esthetician's dream. Now these are cysts and they're very difficult. I get cysts and I have no idea why, but at the first sign of a cyst, I use my salicylic acid peel and I put it right on the cyst. And believe it or not, by repeating that action twice a day, the cysts go down, they dry out, and I have very little occurrence of my cysts. So you can use your salicylic peel as a way to, as a prophylactic to help people with cysts. Now some acne facts. Well, we know that it's a disease involving the hair follicles and the sebaceous glands. Almost no one escapes their teen years without experiencing a few pimples. I've had some of my clients, however, tell me that they had beautiful skin as teenagers, and when they hit their 20s and 30s, they started breaking out. And this is more common than you think. Nearly 100% of individuals have had at least some experience with acne. Only 10% of adults remember having acne, but 80% of adolescents say they have the disease. It's a skin disorder that usually begins during puberty. Many adults, especially women, have a low-grade persistent form of acne, and that's what I have. I have oily skin, and so I'm always working and treating my actinic skin. It's highly treatable, sometimes preventable, and even curable. 40 to 50% of women in the U.S. between 20 and 40 experience some form of acne. And that's what I'm seeing in my clients. It just amazes me that these young women are really having a severe problem with blemished skin. Some of the causes: hormones. We all know changes in hormones level due to menstruation, pregnancy, and menopause can lead to increased sebum production. Puberty. In the puberty, the testosterone level makes the hormones rage and produce more oil. Sebum production is stimulated and produced within the hair follicles. And then you have the dead cells accumulate and move to the surface, causing a plug. Bacteria breeds in the sebum and is attracted in the plug of the dead cells. Sebum, bacteria, and dead cells cause small blackheads, open comedones, and whiteheads, closed comedones. Now there is an acne, P. acne bacteria, and that's where the word acne comes from. P. acne bacteria is a type of bacteria that is in the hair follicle. It is part of the sebum, and that is the acne that is sitting down there and is activated by hormones and other factors, and it starts to brew down there, and so the sebum, and it becomes infected, and then you produce your various acne grays. More potential causes of acne: stress, diet. I've talked to people that swear if they eat chocolate they break out. There is no actual documentation that chocolate causes a breakout, but we do know that foods high in iodine may cause a breakout, like shellfish and other foods that are really high in salt content. Fatigue, sharing makeup sponges, pressure and friction on the skin, picking at the skin, seasonal changes, drugs, and some people have a hereditary background that is prone to breaking out. Acne rosacea. It's an inflammatory condition involving the facial blood vessels, and it's commonly referred to as adult acne and usually appears in the 30s, 40s, or 50s. It's much more common among women than men, but I see a lot of men who are coming in with acne rosacea. In fact, I'm treating 3 of them right now. One of them is my husband. The symptoms are reddened areas appear in a butterfly pattern, red bumps and whiteheads, swelling, inflammation, watery, burny feeling in the eyes, and in the most advanced stages, there's a red bulbous nose because it's a buildup of vascular tissue, and it's called rhinophyma. I did have a beautiful young lady who had advanced rhinophyma, and she was able to find a dermatologist who specializes in this, and the dermatologist was able to take a laser and go through that vascular tissue and get rid of a lot of the bulbous tissue on her nose, and it was just a miraculous procedure. So there is help for those of you who have rhinophyma. This is what acne rosacea really looks like. I've had a lot of dermatologists tell my clients that they have a little bit of redness, erythema or cuperose, that they have rosacea. I guess it's sort of a catch-all word now, but really true rosacea is the pictures that we have down at the bottom of this PowerPoint. It's prevalent in people between 30 and 50, usually fair-skinned, light-haired, light-colored eyes, Celtic background, Scottish, Irish, English. Conditions which irritate: sun exposure, extreme temperatures, hormone fluctuations, oral estrogen, hot drinks, hot baths, emotional stress, spicy foods, alcohol, and exercise. Well, almost everything really affects the acne rosacea. Acne and darker skins. There's a lot of hyperpigmentation and a lot of cystic acne in darker skins. They have more oil glands. The stratum corneum is denser. The inflammatory reactions tend to be more violent, more risk of scarring. An inflammatory response causes the stimulation of the pigment cells. So if you are a woman or man of color, you're going to have more problems with hyperpigmentation associated with your acne. Hyperpigmentation in ethnic skin. Hypopigmentation can occur, an absence of melanin, but hyperpigmentation is most common. The most common topical treatments associated with pigment alterations include benzoyl peroxide, retinols, and salicylic acid. In predisposed clients, patients, hydroquinone can be irritating and lead to hyperpigmentation. We have wonderful lightening gel with kojic acid that we recommend for our men and women of color. Clients with ethnic, dry, sensitive skin can avoid pigment alterations by using products that are formulated in emollient-based vehicles or with a lower concentration of the active ingredient. This is a real client. We gave her a series of salicylic and alpha hydroxy whitening exfoliator peels. We did a series of 6, and then we did maintenance, and you can see how beautiful her skin turned out. We put her on maintenance of our Lightning Gel 10 with kojic acid and ascorbic acid, and she is really doing well to this day, and it's an excellent way to help treat hyperpigmentation associated with acne. Here's more of a client. She had a lot of hyperpigmentation from her acne breakouts, and we did the same thing. We did a series of 6 peels, 3 with the glycolic, and salicylic, and 3 with the alpha hydroxy whitening exfoliator, which is our new product. And you can see that she had an excellent result, and now she's on maintenance with once a month. She has the alpha hydroxy whitening exfoliator, and she also is on our Lightning Gel 10 with hydroquinone. Striving to control the actual skin conditions that contribute to acne is an achievable objective with beneficial results. That's really important to know. The removal of dead cells with salicylic acid keeps the follicles open and clear. I love salicylic acid. If I feel like I'm having a breakout, I get out my salicylic acid and I put it directly on my skin overnight, and it dries it up, and it really works great on my cystic acne. The antiseptic action of these acids kill the bacteria and prevent infection. Lower pH means more acidity, less bacterial. Our salicylic peel with the alpha hydroxy whitening exfoliator is a wonderful way to go to help your client. And a high percentage of dermatologists classify salicylic acid as the most effective treatment available. It is really my go-to when I have breakouts or my clients have breakouts, and it works beautifully. Do a salicylic peel, put them on the lightning gel, and you will see miraculous results. Now, here's a treatment for acne with hyperpigmentation. The salicylic peels with, like the same before, the alpha hydroxy whitening exfoliator, hydroquinone and kojic acid, vitamin C. We have wonderful vitamin C and vitamin A. We have the salicylic acid. And be sure you use a sunblock to block the production of the tyrosinase enzyme, which activates the melanin, and daily maintenance to prevent reoccurrence. Here is what I've written for a treatment of hyperpigmentation and acne. This is a morning and night routine. Use your salicylic cleanser, your toner 8 during the day, your beta alpha, which is both salicylic and glycolic acid. At night, if you need eye cream, Ultra Cream 2 is a wonderful eye cream with 2% glycolic. Your vitamin C during the day and vitamin A at night. Repair and renew. When you feel like you might be getting some blemishes, use your Gel 15. Moisturizing sunscreen is your lotion 10 with an SPF of 20, and then use your plain lotion 10 at night if you need a little bit of a moisturizer. And hand care, of course, is our Creme 20. Exfoliation, mix a little of your loofah with your salicylic cleanser. It makes a great exfoliant. And of course, your treatment mask is your Sal Mask 1, and then your lightning gel with or without hydroquinone, depending on the type of skin you have. This is really a very simple regime, and it works very effectively. This is the client's results. As you can see, she has a lot of hyperpigmentation from acne. After we did the peel, She really has nice smooth skin, and if she keeps on the same regime, including the lightening gel, she will really have a great result for a long period of time. You know, it's maintenance. It's great to get rid of the blemishes and to get rid of the hyperpigmentation, but you need sunscreen and you need the lightening gels and you need the salicylic products to really keep the maintenance of the results going. And of course, your client should come in once a month for an AHA whitening exfoliator peel or a salicylic peel. Treating acne with peels. I am a great believer in peels. I love peels. I think that they are just fabulous for getting visible results. Salicylic peels are my very favorite for acne skin. Very effectively lift the top, most infected layer of the skin. It dissolves the glue which binds it to the underlying epidermis. It triggers a burst of cell division which accelerates the skin cell production and shedding. Salicylic acid also penetrates deep into the skin and helps clears pores and reduces excess oil. Let's talk a little bit about skin anatomy. You all remember this from school. We have the epidermis, the dermis, and the subcutaneous. In the state of California, and that's what we're going to use as our model, you cannot go below and peel live tissue. So you are really allowed to only peel the top of the epidermis or in the stratum corneum, which is the epidermis. Only the epidermis can be treated by an esthetician. So you are really only to do very superficial and superficial peels. The very superficial peel, it penetrates part of the outer stratum corneum. So you can see here, that's about as low as you can go. And the superficial peel penetrates the stratum corneum and the upper epidermis. And that does not have live tissue in it. So it's called a very superficial and a superficial peel. Now, some states like Washington allow you to do a medium depth if you are a medical esthetician, and that penetrates the stratum corneum, the epidermis, and part of the upper dermis. So it does get into some live tissue, but for the most part, estheticians are only allowed to do very, very superficial peels. A deep peel, of course, is always done by a dermatologist or plastic surgeon or a medical esthetician working under the doctor's license. When I worked for the plastic surgeons, I did deep peels, but I always worked with the plastic surgeon. And it was a very meticulous process. It had to be done correctly so that there was no scarring. What is salicylic acid? It's a beta, okay? It works as a peeling agent, which means it contains hydrogen and oxygen atoms. It helps exfoliate dead skin cells and unclog pores that can lead to breakouts and impurities. That's why when I feel like I'm getting some breakouts, I just take the salicylic acid peel and just swipe it on my face. Salicylic acid is also a natural ingredient that does not generally cause skin irritation when used properly. What are the benefits? It treats acne, fights blemishes, benefits oily, aging, and sun-damaged skin, opens clogged pores, helps prevent lesions, and prevents pores from clogging in the first place, assists textural changes, and post-inflammatory hyperpigmentation. It occurs in nature. You can get it from sweet birch and wintergreen leaves. It is a derivative of aspirin, so if you have someone who's aspirin sensitive, please do a patch test on the inner side of the elbow. In fact, I do patch tests on all of my clients that I feel are maybe have a reaction to the peels that I give. And it's very important, and it will save you a lot of grief in the long run. It's excellent for the treatment of acne. Effects are similar to Retin-A, but with less irritation. It is soluble in oil, and it exfoliates oily areas. The difference between beta and alpha, alpha is a water soluble, and betas are oil soluble. Some of the practical applications, these are more of what we talked about. It helps produce collagen, and it helps smooth lines, reduces fine lines, helps heal and protect skin from the effects of photo damage and free radicals. So it has other benefits besides just treating acne. Clinical applications: creates keratinize, which unglues the cells in the stratum granulosum, which allows shedding of the cells, shedding of abnormal cells, stimulates the growth of healthy new cells. That's very important when you're dealing with inflamed skin. Increased volume in dermis creates a reduction in wrinkles and scars. Is having a peel the only way to get results? Of course not. We have structured our home care that you will get really excellent results. It's just having a peel is going to speed up that process. This is a home care regime for oily, blemish skin types. We talked about this before. Excellent products: salicylic cleanser, toner 8, vitamin A, gel 15, lotion 10, and of course your lightening gel, enlightening gel with hydroquinone and without. And this is for moderate to severe acne skin types. We've increased the vitamin C with vitamin A. The gel 15 I would use every night. And then don't forget about your moisturizing lotion. Get your lotion 10 with an SPF 20. And at night, if you need a little bit moisture, you can use a creme 10. And of course, our lightening gel with or without hydroquinone. These are our brand new packaging. I just love it. I think it's very classy. They're very clean, they're very nice, and I have them on my shelf, and they look fabulous. Did you know that our products are patented? Very few formulations have an actual patent, and our vitamin C and vitamin A is a patented product, and we're very proud of that. It's a United States patent, and it's been patented since 1995. We've been in business a long time, and we really are proud of our products, and we've used them on thousands and thousands of clients and patients, and we know that they work. Our home care contains a 2 to 20% glycolic. We have cleansers, astringent, moisturizer, treatment products, and sunscreen. Our professional care, we have glycolic peels, salicylic acid peels, trichloroacetic acid peels, Jesner's, and our AHA whitening exfoliator. A whole range of products for anything that your client needs. Our target market, we sell to destination spas, wellness spas, day spas, full-service salons, schools, physician-sponsored day spas, and medical spas. Let's talk a little bit about our etiology line of products. Our Cleanser 3, this is the workhorse of the line. It is a great cleanser. It's exfoliating cleanser for the face and body. I put it in the shower with me, and I use it all over. I also mix it with the loofah, and it makes a great scrub. It's sensitive skin, apply to wet skin for neutralizing. It can be used as shampoo for itchy scalp. I use it because I have a little bit of psoriasis in my scalp, and it works wonderfully. And of course, it contains no sodium lauryl sulfate and is a non-alkaline formula and fragrance-free. It's a 3.9 to 4 pH, so it is gentle to the skin. This is our therapeutic. It's our therapeutic treatment cleanser. It's a gentle antibacterial wash for all skin types, 100% fragrance-free. It's really good for conditions such as eczema, psoriasis, and rosacea. I use it for my eye makeup remover on my clients, and it has a higher pH of 4.5 to 5.5, which is right around the pH of the skin. The active ingredients, though, is what's so important. It feeds the skin vitamins A, B, C, and E, which really feed the skin and give the skin the nutrients that it needs. And of course, I love our loofah. It's a gentle exfoliator with pumice beads, and they're round and they don't pit the skin. It removes surface dry dead skin cells, and it can be mixed with our etiology cleansers, especially for sensitive skin. My husband uses it at a pre-shave exfoliator, and it's like a 10 skin. It gets those hairs out from under the pores. And it's fabulous for manicures and pedicures. I make sure that my clients who are manicure nail techs have this, and they can use it as a great scrub, especially for a pedicure. Its active ingredient is man-made pumice granules, and it is a neutral pH, which means that it's great for sensitive skin. This is our cell cleanser 2. This is recommended for acneic skin. Antibacterial gel. It's effective in controlling blemishes. High performance antibacterial gel, great for teenage and adult acne. It's antiseptic and anti-inflammatory. It keeps the follicles open and free of bacteria. Can be used on your back. You know how men get all those blackheads on their back? It can be used in the shower on your back, and it's excellent. The active ingredient is 2% salicylic acid. And toner aid. This is also recommended for acneic skin. The toner is astringent. It provides the removal of surface oils and fats. It enhances the penetration of topical products, 8% glycolic acid. Teenagers can use it twice daily to combat oily skin and breakouts. Use it on a T-zone or other areas of the skin with excess oil. Replenishing toner. This is another one of our toners that feed the skin. It hydrates, nourishes, and heals. It's enriched with vitamins A, B, C, E, and pynogenol. Pynogenol is 20 times stronger than vitamin C, and it's 50 times stronger than vitamin E. It delivers temporary relief of itching, skin irritations, inflammation, and rashes. It normalizes the skin's pH. The pH is 4.5 to 5.5. Lightening gel with hydroquinone. This was developed to treat hyperpigmentation, skin discoloration, and uneven skin tones. We combine 2% hydroquinone with 10% glycolic acid. The two of them together are a great combination. The glycolic helps the hydroquinone go down deeper into the epidermis. It helps reduce pigmentation from acne, but always consult your physician if you're pregnant or nursing, because hydroquinone could be it could be contraindicated. It's great for treating age spots on hands and chest. Always apply sunscreen after application, and it's best if used within the 6 months of the time you buy it. And we have our lightening gel 10. This does not contain hydroquinone. There are some people that have a sensitivity to it, or they don't feel comfortable using hydroquinone. And if you are darker complected, a person of color, you should use our lightening gel with ascorbic acid and kojic acid. And this would be better suited to your skin type. Beta alpha 10. Beta meaning salicylic, alpha meaning alpha hydroxy, 10%. A highly effective astringent combining alpha and beta hydroxy acids. It controls acne. It has an antiseptic action. It can be used on spotty backs and chest area. Its active ingredient is 8% glycolic acid, 2% salicylic acid. This is a wonderful, great tool for keeping your skin blemish free, and it's excellent for blackheads on your back and breakouts on the chest area. Gel 15, this is our highest strength gel. It has 15% glycolic acid. It reduces the buildup of dead skin cells. It's used in conjunction with antioxidant vitamin A to stimulate the rapid growth of new cells. Excellent resurfacing for arms, legs, neck, chest, back, or ingrown hairs from shaving. It has a multitude of uses, and you can mix it with different serums. It really is a great product. Hydrating moisturizer. This is a luxurious, wonderful, smooth feeling moisturizer. It's highly effective antioxidant hydrating moisturizer. It has the vitamins A, B, C, and E. It replenishes the skin. It improves the cell nutrition. It softens and smooths fine lines and wrinkles. It really is a wonderful healing moisturizer. My clients love it, especially my older clients who have dull, mature skin who has sun damage. It goes on, and you can't believe the difference how their skin just shines and glows. It's an excellent product, and I can't keep it in stock. I just sell it like it's going out of style. People love it. It's wonderful. Ultra Cream 2, this is great for actinic skin also. It contains 2% glycolic. It can be great for around the eye area, but it can be used on other areas of the skin. If you have dry patches, it can be used as a moisturizer to reduce your glycolic acid strength. It has a very high intensity moisturizer. It's very therapeutic for sensitive skin. It's not just an eye cream. It can be used all over the face. I think it's a great product. Creme 10. This is a non-greasy lightweight moisturizer. It contains 10% glycolic acid. It doesn't contain any petrolatum. It does not contain sunscreen, but it's ideal for clients with combination skin. It should be used as a night cream, and it's great to use for people who have acne and blemished skin. Creme 20. This is a hand cream, but I have a lot of clients, I have to tell you, who have really sun-damaged skin that is thick, and they love this Creme 20, and they use it as their moisturizer. It has 20% glycolic acid, which is a very high rate in a take-home home care product. It aids in reducing skin discoloration. It works great on calluses of the feet. This is another product that I insist that my clients who are nail techs take home and use on their clients. It resurfaces and smooths the skin's texture. Use it on your hands. You know, you can always tell the age of a person by their hands with all the brown spots. Use it and then make sure you use a sunscreen on top of it. It's a wonderful product, and it can be used in many different ways. You can use it all over the body if you just want a nice, rich feel. If your skin is particularly dry, it's great. It exfoliates that dry skin, and it goes down and resurfaces and smooths the skin's texture. Lotion 10. This is a high-performance non-greasy day lotion. You use your Creme 10 at night, use your Lotion 10 during the day. It's non-greasy, it penetrates immediately, it has a 10% glycolic acid, and we also have it, as you'll see later, have with an SPF of 20. Our sunscreen is SPF 30. It protects the skin from the UVA and UVB rays. Now, here in Washington, everybody says, well, we don't have the sun come out that much. I don't use sunscreen. You have to remember that the UVA, which is the aging rays, and the UVB, which is the burning rays, are out every day, even if it rains or snows or it's overcast or it's sunny. Those rays are still out there, and with our ozone layer, you are really setting yourself up for skin damage. I tell you that, you know, these UVA and UVB rays, they destroy the DNA of the cell. They destroy the cells. And so 90% of premature aging is sun damage, according to the American Dermatology Association. It's so important. Every client of yours should walk out with a sunscreen, either our Lotion 10 SPF 20 or a sunscreen SPF 30. It absorbs immediately. It's an excellent product. It feels good. It doesn't leave your face looking white. Lotion 10, this is recommended for acneic skin. It has an SPF of 20. It has the same ingredients as the regular Lotion 10 has, but it has the added ingredient of the UVA and UVB protection. Great product. Soothing cream. This is a really unusual and unique product. It has a lot of the properties of hydrocortisone, and it's a natural moisturizer and anti-inflammatory agent. It contains avocado, fractional distillates of lemon rind and hops, and it's smooth, soothing, and calming. And it's formulated to reduce irritation or redness on the skin. I use it all the time after my peels because it really brings the skin back to its natural condition. It feels good on the face, and it's very therapeutic. It can be used on all areas of the skin that are irritated. It's great after waxing. All you estheticians, you need to put this on post-waxing after you use your wax off. Use this as your final step. It will take away the histamine from the waxing area, and it neutralizes any redness. And if you are using alpha hydroxys or glycolics, use this after you do the peel. It helps balance the skin's pH, and it's an excellent home care moisturizer after a salon peel. I really like it, and I have it in my purse because, you know, you never know when you're going to have an irritation or roughness on my elbows, or it's just a great product. It's more like a medicine to me than a skincare product because it has so many uses. Our Cell Mask. This is a great mask. It's antibacterial. It has clay mask for acne, oily skin, bentonite and kaolin. It helps to control blemishes and oil, penetrates deep into the pores, reducing bacteria, drawing out pore clogging debris and dead skin cells, controls shine and heals breakouts, removes excess oil, and it keeps follicles free of bacteria. It has a pH of 6, so it's very gentle. The active ingredient is 2% salicylic acid, and it has the white clays in it. Our rejuvenating mask. This is another delicious mask for all skin types, enriched with vitamins. Remember, we talked about how important it is to feed the skin. Vitamins A, B, C, and E, and our natural moisture factor, NFF. It says superior moisturizing properties. It leaves the skin toned and revitalized. This is wonderful after an alpha hydroxy glycolic peel or microdermabrasion treatment. You'll love it. It has a great texture. It's easy to put on and easy to take off. Now we're getting into our vitamin A's and vitamin C's. These are really great products. They're very, very effective, and very few skincare lines have our type of vitamin A and vitamin C. They are patented, and they are special, and they have visible results. It contains 7% retinol palmitate, which is the most stable vitamin ester. It doubles the cellular turnover rate. It helps thicken the epidural layer and plumps out the lines. And it won't cause redness, irritation, or photosensitivity. Beneficial for all skin types. Used before gel 15 to expedite the cell renewal process. This is great if you prefer not to use Retin-A or Renova, but you want the results, because it doesn't leave the skin with a lot of the irritation and redness that Retin-A can do. But like anything that's very potent, consult with the physician if pregnant or nursing, and it is a patented product. Vitamin C. It firms the skin while increasing the skin's elasticity. It was the first vitamin C product developed for topical application. We have regular vitamin C and we have 25% ascorbic acid concentration. It increased the fibroblast cells, and all you estheticians out there know what that does. That helps in collagen production. It also helps with UVA and UVB damage. It contains pronogenol, the most powerful antioxidant available. We talked about before. Pronogenol is 50 times stronger than vitamin E and 20 times stronger than vitamin C. May be mixed with our sunscreens. Best if used within 6 months, and it is a patented product. Keep it out of direct sunlight. These are our peels. These are our new peel packaging. I think they look wonderful. They look clinical. We have our prep, of course. It's very important that you use the prep and keep it on the skin. It's a degreaser. It helps cleanse and defat the skin. It may be used for pre-waxing for better wax adherence. It really does. I use this before I do any of my waxing, and it really helps that wax so that you only have to have one pull and all the hair comes out. Apply to the skin being treatment with a cotton square or a facial brush. We provide the facial brushes for you. Do not remove. It prepares the skin for an effective peel result. The active ingredient is salicylic acid. The Post Balm. It contains a high moisture content. It has urea. It's a rich moisturizer. It's a great neutralizer for post peels, waxing, or laser. And it has a high pH, so it's gentle to the skin. Do not remove. It neutralizes and calms post peels, laser, and waxing. An excellent product. Here are our peels. We have medical strength glycolic and salicylic acid, Gesner, trichloroacidic acid, and alpha hydroxy whitening exfoliator. This is our glycolic. We start at 35% 2.5 pH. Now in other PowerPoints I've talked to you about the difference between percentage and pH. The lower the pH, the stronger the peel. I've had clients come up to me and say, well, my esthetician used a 70% on me. Do you have a 70%? And I'll say, well, what pH was it? Well, I don't know. And come to find out it's like a 5 or 6 pH. That is not going to give you a very effective peel. The lower the pH, the more effective and the more the peel absorbs. So we start out with a 35% with a 2.5 pH. Our next step up is our 50%. Same pH, 2.5. That's a very low pH. Our next step up is our 35% with a 1 pH. Then our strongest is our glycolic exfoliator, 50% with a 1 pH. We do have a 70%, but that is for doctors and medical estheticians only. Our salicylic acid is 20%. It has a pH of 3. Our Gesner's is one of the very unusual products on the market. We have a 17% Gesner exfoliator. The most you can get from most companies is 14%. So you get a lot more bang for your buck with our Gesner exfoliator. It gives you more visible results, it works faster, and it's a superior product. And it has a very low pH of 2.0. Our trichloroacidic exfoliator is 20% with a 2.0 pH also. And our alpha hydroxy whitening exfoliator is 30% with a low pH of 2.0. These are all excellent peels and they all do different things. Some of them can be combined or used alternately, but they all are very specifically formulated to give you a wide range of peels that you can use on your client to get visible results. We have education classes and sales training. I do personal ones online where you can have a class and get your computer and I'll talk directly to you and I'll work in my spa and show you a real-time client. We also provide webinars. Our webinars now are on YouTube, and if you want to know where they're located, just give me a call or email me. We have customized training for your place of business, interactive website, a monthly newsletter and updates, and you can, of course, can contact me at 360-460-9111, Catherine at etiologyskincare@gmail.com. I want to thank you. Etiology is dedicated to the advancement of skin therapy through medical science. We are a partnership of estheticians, schools, dermatologists, and plastic surgeon. And as always, I am here to help you and make your business grow. I hope to hear from you soon. Thank you so much. Bye-bye.